In the health center tonight, a new study out of Mississippi finds that the number of kids infected with COVID-19 may be higher than previously thought. Earlier today, I spoke with Dr. Charlotte Hobbs with the University of Mississippi Medical Center about one of the only studies of its kind involving COVID-19 and kids younger than 18.
Yes, so this was actually a study in which we looked at antibody responses in discarded samples in patients under the age of 18 who would have had labs done at the medical center or surrounding areas. And we compared looking at the antibody responses to SARS-CoV-2, or the virus that causes COVID-19, to Mississippi Department of Health case incidence data. In fact, they were collaborators with us in addition to CDC. From the beginning of the pandemic in Mississippi to right around when the schools started to reopen in August, September, the period of the study is May to September, we found that the seroprevalence or positivity of antibody responses to SARS-CoV-2, the virus that causes COVID-19, increased each month by about 3%. So there was a really steady, clear increase by seroprevalence data, and this exactly paralleled what we saw with Mississippi Department of Health case incidence data. However, it was parallel but several-fold higher. What we actually found was during this period of time, there were about 9,000 cases reported in the age group under the age of 18 in the state of Mississippi. And in comparison, we predicted that the number of children who would have been infected would have been more than 10 times that amount based on our seroprevalence data, because we found so many more samples that were positive for immune responses to SARS-CoV-2.
In the beginning of the pandemic, there was a lot made about children not being as susceptible to the virus and not getting it as severe cases. Do we need to reevaluate that now?
So I think we need to continue to study the evolving disease process of SARS-CoV-2 and COVID-19 in children in general. There are many more children infected than our case incidence data suggests. And so because we know that kids usually get infected from adult household contacts more commonly than from other sources in general, the bottom line is that we need to continue to abide by very strict measures to protect our children from infection, because they can get infected. And in fact, it appears they're getting infected a lot more frequently than any of us previously realized or understood.
What would be your advice as a medical professional in terms of school reopenings?
But as we all know, the shock waves of this pandemic have greatly impacted our children in terms of them being able to attend school. And so we know that they can get infected. They're definitely vulnerable to infection. So what's important is to remember that these measures, mask wearing, social distancing, hand washing, are so important to be hyper vigilant about in order to continue to protect our children and keep them safe. So this is not in any way suggestive that children should not go to school. What it shows is children are vulnerable to infection, and so we need to continue to do whatever we can to protect them and to protect ourselves, keep everyone safe.
What are you looking for long-term when you talk about studying children and the long-term effects of COVID-19? What are you going to be watching for?
So there are many studies actually that we're engaged in at the University of Mississippi Medical Center in partnership with many other children's hospitals throughout the country, in addition to collaboration with CDC. The ideas are to really better characterize the epidemiology of this disease in children, its immediate effects as well as its long-term effects. And then in parallel to that, as a pediatrician, first and foremost, and as a mother, I'm highly interested in making sure that we continue the conversation as to how we can get all of our children back into school safely and healthfully, because we know the benefits of being in person in school.